will be presented by a master degree of Mr. Maikho. And this study will show the impact or the factor associated with breastfeeding in Vientiane province. And for this study have been supported by capacity strengthening for research on nutrition. And it's good time that today everyone will gain the knowledge and then we can discuss. And if you have questions, you can ask to the speaker at the end of this. And I hope that all of you who participate in this seminar will gain new knowledge, and also we will achieve our seminar objective. And would like to wish everyone stay healthy and success. Take this opportunity to open this seminar from now on. Thank you. Bộได้ยินเสียงไมโครนะโอเคเก่าแต่ยินเนี่ย This is screen he checking. Yes, we see. Yeah, first of all, dear all, for your time participating this seminar on the result of the study on the factors associated on breastfeeding in Vientiane province. And Madam Chair already talked about it. And this topic is the first topic that received this funding from ANRCB through CIS. And our nutrition center have collected the information in Vientiane province as a pilot for this study regarding the factor associated with breastfeeding. And I will talk more detail in the next slide. And allow me to introduce the team for this study. My name is Maikho Vongxay, staff at the CN, and Dr. Subasai Kampantong, Deputy Director, and also Vilasit Kilasit from the training center, and Dr. Pornpraset Suralak, Center for Nutrition, and supervised by Dr. Pornsawan Kelnakon, Director of Nutrition. And we have mentors, Mr. Roger So, who is an associate professor in Purdue University. For the scope or the frame, it covers many areas. The first one will talk about the background and the ratios and the questionnaire and the objective and the concept, and also study methodology and analysis, and also report of the result. In overall of this breastfeeding promotion, and also it's linked to the newborn baby, that we need to promote exclusive breastfeeding up to 6 months, and it's the crucial life period that the child need to receive the vitamins from breast milk. And globally, we promote exclusively from birth to 6 months. And we will continue until 2 years of age, but we will have supplementary food to add after 6 months. And it's an important period that can promote physical and mental development of the child, or we can call 1,000 days that can ensure the survival and the healthy of the baby. And based on the study, national study, the breastfeeding after birth is 39% that we found in the ELSIS study 2012, and about 50% in 2017, and exclusive breastfeeding from birth up to 6 months from ELSIS 2012, it's 44%. And after that 5 years, there is another study, and we see is increased from 44 to 45%. And then we also see the bottle milk feeding, and we found that in the study 2012, 17%, and then 5 years later, we see it increased to be 34%. And this quite challenge that can impact to protection and promotion of breastfeeding. And in addition to the COVID-19 pandemic, also another challenge that can impact to the access to the health services in the facilities, especially access to the ANC. And because the child or the mom who should receive the counseling during the service or the ANC time will be challenged during the pandemic time. And also the continued breastfeeding is a priority of the Nutrition National Plan of Action that we lay out the measures and plan from 21 to 25 in order to reduce the malnutrition in Lao PDR, and also to improve the nutrition and health, especially for the young child. And that is one reason that our nutrition center have selected the topic on the breastfeeding promotion. And we want to see any factors that associate with breastfeeding. So this is the first topic that have been supported by ANRCB project. And for the question, we're looking at what are the prevalence of breastfeeding on the breastfeeding promotion during the COVID-19, because during our study, it's within 21 to 22. And after the COVID pandemic, what are the level of the breastfeeding? And also we want to see the factor that associated with the effectiveness of breastfeeding protection and promotions and support, especially in Vientiane province as a pilot. For the objective, we try to see the factors that associate with the promotion of breastfeeding in Vientiane province, and we have some objective that we want to study on the percentage of breastfeeding in Vientiane province, how much there? And that is one objective that we need to study on. And the second one is to confirm and to find out the factor that associate with breastfeeding promotion and support, and what are the things that we need to analyze, the cause. Are he checking if everyone here? Yeah, I think. Yep. Yeah, he just checking if everyone here then. And then we have the conceptual framework in order to find out the causes, and we develop this conceptual framework, and we lay out the level of the significance, or we have a dependence variable. And on the left hand side, we have independent variable based on the breastfeeding. And for the first for the independent variable, we classify in 3 levels that considered to be additional factors based on the geographic, educational level, and also income status, as well as the family that they have, the child in their household, and what are the factors that associate with the breastfeeding. And also we are looking at the knowledge on the breastfeeding. What are they in addition or association to the breastfeeding, and also period of the breastfeeding, how long and how often. And also we're looking at the medias or IEC materials that impact on the knowledge of the mom of the child. And the last one, we look at the culture and traditions that associate with. And within this conceptual, in this slide, we are not describe everything because we have more information. But we just present the key message or key information because we have limited time, only about 1 hour, he said. For the methodology, we use our analytical cross-sectional study. And for the period we implement during 2020. And we select 4 districts in Vientiane province as Phon Hong, Vieng Kham, Keo Dom, and Tulakom. And 4 districts are some districts that are in the outside the outskirts or urban area. And we select the mother that they have the children less than 2 years old. And each district 25 mother, and in total about 100 mothers that we will include them in this monitoring and interview. And we have a face-to-face interview, and we visit the facility in each district, and then we will check the list of the mom that have the child less than 2 years old, and then we will random select, and then we will ask the health center or facility staff to contact to the mom, and then we appoint them. And as well as if someone already in the facility, we interview them directly. And these are number of the general informations. We have about 100 children and cover boys and girls. And we have a male 47 and female 53. And the result on the education study, we see that the mother in 4 districts, the educational level, mostly they graduate high school level as a majority, and some people graduate primary and some at the middle level, and about 52% that graduate high school. And now we look at income. For the income also impact on the breastfeeding. And from the statistic showing that the mother income annual basis, this is a household income, he said. He repeat again. And almost they have income more than 50 million per year. And this slide showing the access to the ANC at the facilities. And in this information, we study on the level of the ANC, and we use the standard number, and we compare at least 4 times of ANC. And in overall, we see in our target group 62% they have complete ANC more than 4 times, and it's a good standard, because if you access more than 4 times, it's meet the standard criteria, and we get 60% here. And in this slide, you will see the perceptions during COVID time that can impact on the breastfeeding. And we have asked that if the mom got COVID, for example, did you still feed your baby? And 67% the answer, they still fear about COVID, and they might not keep breastfeeding. So it's one fear that can impact on this breastfeeding. It's about 60% on the fear of the COVID pandemic. And for the portions of the breastfeeding, we divide into 4 districts. For the orange color is target of the national action plan. It's 60%. And if we compare in 4 districts, some district like Tulakom is 40%. So still in the middle, or still way to achieve the target. For Kyaudom, it's close to the target. They achieve 52%, and the target is 60%, and it's vary in different districts. And this slide will talk about the analysis and also adjusted on the reason or the factor of the breastfeeding that associate with the breastfeeding outcome. In this table, we divide and we compare by districts. We can show you by district at the level of the variable by the age of the mom and age of the child and the ANC time and the gender and the health status of the child and also a mom education and also the COVID situation. And on the left hand side is about the advice from staff and also from peer. So in overall, we have analyzed this statistic by classify the portions and compare with the districts if any variable have the factor associated with the breastfeeding. And here and the result in the orange box, the target student compared with the variable and p-value less than 0.015, we see that there are few things for the independent variable about the access to the ANC. It's the factor on the promotion of the breastfeeding, which we can see from this statistic as a p-value that acceptable level is less than 0.15. And also the other one is about advice from the health staff and p-value it's 0.034. It means that the mom that have been consulted during the ANC should have high impact on the breastfeeding by the p-value of statistic should less than 0.05. That it's about this some p-value standard. And then we group based on the variable standard for breastfeeding. The first one is the ANC, and the second one is medical advice, and number 3 is about the concern on the COVID. And we will look at the close data and also not close data. And we use this statistic analysis, and we can see that there are 2 things. For ANC and also the medical advice. And when we use that coefficient plot analysis that we compare with the value of 1 or 2, and we found that OR is about 1.2. It means that any mom that have visit ANC, it should be impact on the breastfeeding about 1.2 times more than other people who not visit for ANC. And the standard that we already mentioned about more than 4 times. And the second variable for the medical advice, and the result is 3.2. If it means that if any mother that have been advised by doctors or staff, this impact should be at the 3.2 times compared to the mom that never get the advice from medical staff. I think you do understand it. And this is about the statistic analysis, and we use data from Purdue University, and we analyzed together, and we see this clear result of two variable criteria that impact on the breastfeeding. And the first one is ANC, and the second one is medical advice. And at this slide, any question and before we move further, or you will wait until the end? He checking. Any question? He checking again. Still no. Yeah. So it's mean that the finding, and we need to disseminate. It's this study did not show any valuable that we set for associate to breastfeeding, and we assume that there might be another factor like age of the mother, and also the result not showing the age associations. And also there are some other study from other country, and we see that some it's related to in some country like and in our country or in the region, showing that there are some association with the age of the mom. And also, however, the concern on the COVID-19, there is no impact on the breastfeeding. And also we surprised that when we ask any fear on the COVID-19, yeah, the answer is a fear. But in statistic analysis, we don't see it. And similarly, other study from other country showing that the ANC and also the time, number of time on the ANC, and also duration of ANC, and also the advice from the staff showing the impacts as well. And then about the limitations of the study and lesson learned. And from this study, we see that there are some limitation, especially we select the district that are close to the urban or to the city, and most of the mom are close to the city and still not being selected from the rural area because we have limited budget. Therefore, we select only from the city area. But in the future, we will select more in the remote area. And also the study on mother still not showing the impact on breastfeeding. Even the result from the study, we still don't see any statistic value that's showing the impact on the breastfeeding promotion. There might be other factor or can be other bias since we have a face-to-face interview, but we need to study more. Actually, it should showing some associations, but however, we will study more. There might be other bias during interview as well. And for this study, there are some discrepancy on the geography, and also the discrepancy of the knowledge of the interviewer, and we have short time for the training, and we use only 1 week, and then we conduct the collections. And we can learn more in the future. We might plan in detail before we can collect the data. And the last point is about to develop more variable criteria, that we will select anything that associate with the breastfeeding and also the pandemic, because it's a new pandemic of COVID-19, and we still don't know about the level of the impact, and also what are the hidden factors in associate with this breastfeeding. And in next study, we might look at other variable again, especially the one that associate with the outbreak of COVID-19. Because during the collection is the time that COVID-19 start to reduce the outbreak. And if during the outbreak time, we might see clearly if any factor that associate with the breastfeeding. And for conclusion, in overall for this study, we see the ANC service and access during the pregnancy, and number of ANC, it's slightly to impact to have more percentage of breastfeeding than the bottle feeding. And the second one, the support from the staff, like they gain the advice on the breastfeeding or young child feeding, especially exclusive breastfeeding and up to 2 years. It's the factor that associate to the increase of the breastfeeding promotion. And however, we still not surprised, but there are something that still no impact on the breastfeeding from this result. As we need to advise mother to access to ANC more than 4 times, and also the staff need to advise them more on the breastfeeding, and those are needed and important. And for this study, there are some recommendations. And we can provide more information to the government or the leader about the result of the breastfeeding. That can be one information for decision makers and also for the public health team, in order to plan the activities to promote breastfeeding more, especially women need to access to the ANC more than 4 times, and in addition to receive the advice from the medical staff. That can be the impact in order to improve breastfeeding. And for a donor, need to continue the support on the breastfeeding more. And based on this study, and especially to promote more ANC and also the advice from the medical staff. At the same time, the policy and guideline that need to be improved for breastfeeding promotion during the COVID-19 pandemic, and also the promotion on ANC more than 4 times that need to be improved and included in the guideline and to make it in line with this study result. And the health staff in the facility level, including in the hospital, health center, and the district hospital, need to scale up their knowledge in order to gain more expertise, and they can provide advice regarding the breastfeeding. And in our nutrition center, organized for this kind of specialized, but however we need to increase number more, and we need to post them at the facility more. So in overall, the presentation on the factor associated with the breastfeeding is ending. And if you have questions regarding the result of this study, if you have any doubt, any unclear point, please feel free to ask. Thank you. Still nobody asked question? Yeah, Vivek. Yes, now he encouraged the participant to ask questions regarding the factors associated with breastfeeding. And there might be one thing that we can learn more in next study, and we can study more deeper. Now he suggests that we open the floor for our discussions, if any. Please, if anyone. There is one person. Sabadi. Please, he urged. Yeah, there is a one person. So he said, can I ask now? Yes. Yes, thank you, Dr. Maikho Vongxay, for your presentation. My name is Sanya from, and I participate on behalf of HPA, Laopedia. And thank you a lot for your presentation on the result of the study. It's quite interesting, and see that it's a good information for us in some area. As you mentioned from this presentation, there are some limitations in order to gain more information. And because there are a few points, the first one is about the populations of this study. I think one reason, maybe it's too small sample in this pilot, only 100. So should be more than 200 based on the theory. That is from my personal view. 100 is quite small. And the second point, and regarding the COVID, and I don't know why you select this question, and why you select Vientiane capital, and why should be the Vientiane capital, which have more population, and also Savannakhet, which have more population. And then we can see any factors that impact on the breastfeeding. This is about my view. So can be one factor that impact on this study. And for the conceptual framework, as you already explained, that it's still not reflect well on the research questions, and it's not linked well. So in the research question, there are factors there, but the findings still not answer to the question much. So this might be the methodology or the data collections process, and also the team for collection as well. So those are my comments. Why? The first one is number of target population, only 100. And second, why we not select the province that have more COVID outbreak, and why only Vientiane province and only 4 districts. So, and other factors that we see within the conceptual framework, anything that we found as a significant finding that we can see in relation to the topic study. And Maikho want to answer now. Yeah. Thank you, SPA, for 3 points. So it's a good comment there. And for the target group that we select small, and by the statistic theory, yeah, it's considered to be small. But based on the time frame that we receive the budget from ANRCB, it's small scale. And however, if we expand the target population, it will need more budget. And also it's a first time of our center, and we still not strong in this, and we just have been strengthened capacity as a pilot project from this project support, and we select only 100 participants and consider to be small if compared with the statistic theory, and we still lack some experience. That's why we select only 100. And in Vientiane province, we select 4 districts because we consider based on the budget. And why we not select other province? Because it will associate with the travel cost. Therefore, this support is a small scheme pilot support. Therefore, we select Vientiane province. Actually, we want to choose Salavan or Sekong, but we concern the time frame and also the budget. Therefore, we could not go far. Therefore, we select Vientiane province, and Vientiane province considered to be the target area that have been supported by some project. And for the southern province is far. And Vientiane capital, it's a city area. Therefore, Vientiane province considered to be a pilot for this. And conceptual framework as well, we acknowledge that we collect more information. I will show some variable criteria. Actually, we collect more social, cultural tradition, belief, and knowledge of the mother. But these data, we will continue to analyze more based on the framework. But there are some limitations of the technical knowledge and analysis. And therefore, we just can do as that one. Because our center, we still don't have researchers or good researchers yet, and mostly we only participate with other. But now we start this research by ourselves. Therefore, we start from scratch, and we try to analyze on the variable criteria that concern to be associated with the breastfeeding. But we have more information that we collect and still not yet analyzed. We just show some factor only, as you can see about the ANC and others. And the knowledge still not here, or education still not here. But we just show some valuable number. But in fact, yeah, there might be some factors. But in the future, can be another level of the study that we can go deeper for more variable study. And this is because of our technical capacity too. Therefore, we could not analyze all. And yeah, even we could not present as a country data as our target population only 100, but can be only basic information for us to know some basic factors on the breastfeeding. Thank you for your clarification. I would like to continue a bit. For the conclusion is useful, but there is one discussion that I still don't see in the outline, because the discussion, if possible, I think we can add if we want to do a future study, because there are a number of factors and numbers, and we can gain more complete data. It's a good thing that we have done this, and how could we discuss with the audience or with the user of this result, in order to be some concept or some guiding concept, and we can discuss more in order to get a comprehensive finding and what we should do more. So we can discuss further, that we can gain the benefit from the study more. So from my personal view, I think we still need to have this discussion in the conclusion and also recommendation part. Thank you, Michael. Thank you. And we will add into the discussion that we still lack of here, and we might pull up more information, and we can show more here. And then also we can request budget from SBA more, maybe we can to do another study too. So again, he said, I want to add, because I just back from doctoring, and I see that I still see the issue that moms still don't breastfeed, and they just chew the rice for them and ask, because why do you do this? And the answer is, they say, oh yeah, we are lazy. Any other factor more than this? And the people confirm again, yeah, we are lazy. So it's quite interesting about laziness. So for the researchers, we aim that it should be from the culture and social factor. But yeah, it's quite interesting, he said, and we can find out more to study more on this. So yeah, there are some answer. Yeah, they say because we are lazy, we don't want to do breastfeeding. So can be another question that we can use for study in the future. Yeah, thank you. And he said he see the hand. This is another person. And first of all, thanks for today's discussion. So this study it's quite useful. And the second one, I agree the comment from HPA, so it's quite good comment. Because the research and we have a small target population and the result compared with the objective still not linked well. And I want to share more on the recommendation. For recommendation, the result of the study, after the result, recommendation should be specific on the activity that we will improve the activity or the result. For example, if a woman don't go for ANC, why and what activity that we suggest can be like health education or dissemination on the media or posters. So we should specific more. Because if we speak in general, the user will not get it clearly. And other things I agree with the HPA, I mean, because the budget and so the time frame. Thank you, he said. Thank you. Any more people want to share comment or to ask question, please? Somebody, there's one person. Somebody, my name Dr. Ladapon Papa Singh is a pediatrician who working on the nutrition, and I see this topic and present by Maikho. It's quite interesting, and myself also interest in this breastfeeding. And for the topic on the factors associated with the breastfeeding, I would like to make my comment from a technical perspective. It's not the factors from this study, because I interest in the factor in relation to the feeding technique. Because from my experience, I found that the breastfeeding mom, they receive the counseling during ANC and at the hospital, and the successful of the breastfeeding until exclusive up to 6 months and to 2 years is still low, because some they still don't know about technique how to get the baby to suck the nipple. So it is about some technique, because in especially the mom that they still have the not good knowledge on the get baby to suck the nipple. And also sometimes they saw the nipple and they pain, for example, and they want to continue, and they turn to the bottle feeding. So there's some experience. Therefore, I want to know from this study, have you asked about this or not? If they have difficulty on breastfeeding, if they stop breastfeeding, what they found as well, or what is the factor of the stopping of breastfeeding. So it's good question. So there are more factor from Maikho, especially to get baby suck the nipple technique as well. So it will be another deeper technical study, but we did not study deeper like that, and we did not ask about the difficulties, because we only ask the qualitative question, and we still did not go deeper. So it's good question that we will take note, and in future study we might include this question as well, because this time not yet that level, and it's good question too. Yeah, even in LSIS as well, we still don't see this question too, about the difficulty on the getting baby to suck the nipple. And we can include in another study. Also in the breastfeeding course as well, we will ask on the expert to develop more questionnaire to make it comprehensive. And yeah, this is the question that the question to ask about qualitative question asked about the difficulty during breastfeeding. And we also ask the medical doctors student to do some study on this to see if they found any difficulties on the breastfeeding and also bottle feeding, because some mom they have difficulty with getting baby to suck the nipple, and they turn to the pumping from the nipple. So we want to study more as well. So that we might develop in the methodology more in the future to adjust in order to study on the qualitative and to study on case control as well, if you have more budget in the future. Thank you, Dr. Ladapon. That's good that you propose this. And in my study, it's a quantitative study. Yeah. And we did not have the time cut or period limitation. So thank you. And if anyone want to ask or want to suggest, please share. Yep, from Michael, to promote breastfeeding more. Or if you want to share some experience from your hospital or from your community, please feel free. Yeah, the other person, somebody, allow me to share. My name is Bang On from Public Health Institute. First of all, express our appreciation to Mr. Michael for your presentation. So it's an important study, and I want to share. The first one, I'm not sure, because I listen and not consistently, because someone walked into the room, she said. The first one, I want to know the sample size, and you have 100 people. Yeah, that's correct. Yeah. I'm not sure that prevalence, what is it, the prevalence, because I did not listen continuously. Yeah. And the second one I want to share, I propose to have a study, additional study. If we have budget, we can conduct quantitative and qualitative study at the same time, like Dr. Latapon already mentioned earlier. That will be good, and then we can expand sample size more, and then we can look at the rural area as well, because we can see that in rural area there are some belief or tradition and the culture, so we can study deep more. So that is my comment. Thank you. That is a good study, or that we can develop further. Appreciate your study, Mr. Michael. And the second one, we want to see the time frame of breastfeeding, like from birth to 2 years. Do you have the percentage from these 100 people in your study? Thank you. So it's good questions, and the prevalence. We did not develop the percentage, but we make in the district level. So in overall, about 40%, not high. Keldom and Ponhong 50. Tulakom 40 and Vietcom 46. So average about 40. This is only for 6 months exclusively, but for 2 years we still did not analyze it. We will collect the data, my budget. Because in the topic, we want to know the prevalence and the factor. Yeah. Thank you. Thank you. Yeah. Any additional question? He checking. And if no more further questions, or if you have, you can take note as well, and you can send your question to us as well, because we almost passed the time. So now it's the end of the presentation, and thanks for all the comment, for all your sharing, and our nutrition center will improve it. And it's our first time, and we could not ignore the gaps, and we can improve in the future. And on your comments, the good things and important for us, that we can improve the gaps, and we can continue our study on the breastfeeding promotion more in the future. And also it's associated with the nutrition, and we need to implement not only this province, but we will expand in other provinces, and we will find more funding for the study. Yeah. And we have some technical limitations, time limitation, budget limitation. And now he suggests that the chair of the meeting will come and conclude the meeting. And now he said that he hand over to Dr. Bunyod Bukkala, Deputy Director of Nutrition, to have his comment and then close this seminar, please. Yeah, first of all, good morning, and thanks to everyone, ladies and gentlemen, and expert and country expert for this seminar on the factor associated of breastfeeding. And we thank you for your participation, and the result is not so good, even from LCs as well. Especially the children under 6 months exclusive breastfeeding in LC still low, and might be on the guess. We have limit time for the study, and we limit budget and time, and especially the budget. Therefore, we only select 100 mothers. So our apology. And if next time, if we have more budget, we can cover the whole country or more provinces in order to represent the breastfeeding data from Lao PDR. Because now we provide the training to our medical staff in the country, especially in the hospital at the central and province level. And we already have the third batch, and next week we will close the third batch, and more than 20 participants participating in this. And however, our center receive more suggestions and comments from all of you, especially for this promotion of breastfeeding in order to increase this breastfeeding. And in Thailand, breastfeeding in 2023 is only 16%, so still lower than us because more people focus on the bottle feeding. And we have more than 40%, so it's equal. So these are my comment. And up to here, I would like to express our thanks to everyone for your participations on this seminar, and wish everyone to stay healthy and success in your career and happy in your life, and hope that in the future we can discuss at the bigger project that can represent the country data. So up to now, I would like to close the seminar from now on. Thank you. Thank you. Thank you. Yes. No. So now it's a close. Okay. Thank you, everyone. Bye.